Hello and welcome to the Understanding ADHD, Attention Deficit Hyperactivity Disorder workshop. Hopefully this workshop will provide you with an overview of ADHD. I'm going to be exploring some of the key characteristics and how this presents in children and young people. We'll then take a look at some practical strategies which can be used to help support children with ADHD. My name is Jodie and I am an Education Mental Health Practitioner for the Mental Health Support Team, or EMHP. My role involves supporting schools with their whole school approach to mental health and emotional well-being, and helping to provide early intervention for children and young people with mild to moderate mental health difficulties. This includes giving regular consultation to schools, where I might give advice and signposting to appropriate services, or encourage a referral into the EMHP. Part of my role is to deliver brief evidence-based interventions for children and young people and their families in education settings. I also deliver whole class workshops to pupils in primary and secondary schools in Calderdale on various mental health and emotional wellbeing topics, deliver parent and carer workshops like this one, as well as training for school staff on various mental health topics. The EMHP are a team of practitioners who are based within your school who can offer support around mental health and emotional wellbeing. We sit within North Point Wellbeing, who also provide the Child and Adolescent Mental Health Services, CAMHS, via the Open Minds Partnership. I'm just going to start by hopefully clarifying the relationship between North Point and Open Minds. So in Calderdale, we have the Open Minds Partnership, which includes lots of different services which offer different types of support. The organisation that I work for is called North Point, and we are the lead provider in the Open Minds Partnership, and we deliver what you might know as the CAMHS service for children and young people, alongside our colleagues in SWIFT, South West Yorkshire Partnership, NHS Foundation Trust. They work with more complex and long-lasting mental health difficulties, but together we provide one-to-one specialist mental health support. At North Point, we also run the FPOC service, which is the first point of contact for all mental health and emotional wellbeing referrals in Calderdale. They also offer advice and support, so if you need any advice or you have any concerns about your child or young person's emotional wellbeing, then you can give them a call. They might offer you some advice, book you in for a call back, signpost you to a more appropriate service, or encourage you to make a referral. They also offer you any risk advice, so if you have any risk concerns, please do speak to them. And we also have the Open Minds website, which has lots of good resources and is a good starting point. We're one of the neurodevelopmental support and assessment pathways, and as mentioned, we also have the EMHP team who work with schools in Calderdale. So the aims of this workshop are firstly going to be to understand what ADHD is. We're then going to look at understanding the different traits associated with ADHD and how this may display in children and young people, particularly how it differs in females to males. We're then going to have a look at some different ways that you can support a child with ADHD. So we'll be looking at different strategies, approaches, routines, resources, etc. that you can use. At the end of the workshop, we'll also be looking at how you can support your child with a diagnosis via the neurodevelopmental pathway and how that works if that is something that you want to pursue, and some helpful support services and resources that you can access if you would like some further help in supporting your child. So what is ADHD, or Attention Deficit Hyperactivity Disorder? Well, it's a condition that affects people's behaviour, and people with ADHD can seem restless, they may have trouble concentrating, and they may be more likely to act on impulse. Symptoms of ADHD tend to be noticed at an early age, and they may become more noticeable when a child's circumstances change, so for example when they start school. Most cases are diagnosed when children are under 12 years old, but sometimes it is diagnosed later in childhood. There are a number of cases where ADHD has not been recognised when someone was a child, and so they've been diagnosed later as an adult. The symptoms of ADHD may improve with age, but many adults who were diagnosed with the condition at a young age continue to experience problems. People with ADHD may also have additional problems such as difficulties with sleep or anxiety disorders. In the notes section for this workshop, I've popped the link to a video called Let's Talk About ADHD. This is a nice child-friendly video which explains the important points about ADHD. So you may want to watch that following this workshop, or you may want to pause now and take a few moments to watch that. So the symptoms of ADHD can be grouped into two types of behavioural difficulties: inattentiveness and then hyperactivity and impulsiveness. Many people with ADHD have problems that fall into both of these categories, but this isn't always the case. So for example, around 2 to 3 in 10 people with the condition have problems with concentrating and focusing, but not with hyperactivity and impulsiveness. So attention deficit disorder, or ADD, is a form of ADHD, and this is when the person has difficulty with inattentiveness but not hyperactivity and impulsiveness. ADD can sometimes go unnoticed because the symptoms may be less obvious. ADHD is more often diagnosed in boys because outward signs are easier to spot. And children may have both inattentiveness and hyperactivity and impulsiveness, or they may have symptoms of just one of these types of behaviour. Symptoms are usually noticeable before the age of 6, and they occur in more than one situation generally, so at home and at school. So some of the symptoms or challenges that young people with ADHD experience are firstly looking at the inattentiveness, which is that difficulty concentrating and focusing. Some of the main signs that we might see are having a short attention span and being easily distracted. Making careless mistakes, so for example, making careless mistakes in schoolwork, appearing forgetful or losing things often, being unable to stick to tasks that are tedious or time consuming, appearing to be unable to listen or to carry out instructions. You might notice they're constantly changing activity or task, and also having difficulty in organising tasks. And then some of the main signs for hyperactivity and impulsiveness that we might see are being unable to sit still, especially in calm or quiet surroundings, constantly fidgeting, being unable to concentrate on tasks, excessive physical movement, excessive talking, being unable to wait their turn, acting without thinking, interrupting conversations, little or no sense of danger. So these symptoms can present challenges in a child's life, including difficulties at school, relationship difficulties, and challenges following rules. And these symptoms can also lead to lots of positive characteristics as well, and we're going to look at more on this in a minute. So people with ADHD tend to have heightened emotional sensitivity. So they may feel emotions more intensely than others, and they may have strong reactions to either the positives or the negatives that they experience. So this might present as them experiencing much higher highs or much lower lows than their peers. Due to their heightened sensitivity, people with ADHD are often highly empathetic, and therefore they're able to understand and share the feelings of others, which can make them very supportive friends. It's worth mentioning though, on the flip side of this, due to some of the common characteristics of ADHD, such as that impulsivity or distractibility, it can sometimes make them seem like they're a less empathetic person. So for example, they might interrupt others during a conversation or seem impatient, which can be then misinterpreted as a lack of empathy. The heightened emotional sensitivity that they experience can also cause physical sensitivities to their environment. So for example, they may be highly sensitive to senses such as sound, sight, smell or touch. So this might present, for example, in them feeling really sensitive to the feel of their clothes, different fabrics and textures, etc. So many people with ADHD can also experience something called rejection sensitivity. Now this is where a person feels emotional sensitivity as a result of things like teasing, criticism or rejection. And this can also, for some individuals, cause physical pain as a result of the intense emotional distress experienced. This can be perceived or actual rejection or criticism. So, for example, they may feel rejection due to what was actually an innocent remark made to them, or they may feel that a small disagreement between them and someone else is a lot more severe than it actually is. They may experience feelings of sadness, anger, embarrassment, which can lead to low mood, and they may then withdraw from social situations to protect themselves from potential criticism. Or they may try to people please and seek approval in order to avoid rejection. They may react with anger or impulsive behaviour, which can result then in a self-fulfilling prophecy. So, for example, they may react angrily or impulsively due to the perceived rejection, which can then cause the other person to push them away, which reinforces the rejection. Girls with ADHD are more likely to have symptoms of inattentiveness only, and they're less likely to show disruptive behaviour that makes ADHD symptoms more obvious. This can mean that girls who have ADHD may not always be diagnosed. They may present with the inattentive symptoms such as being disorganised, forgetful, introverted, struggling to focus on a task or pay attention, daydreaming, being easily distracted, or having a short attention span. Heightened emotional sensitivity can make them more prone to emotional overwhelm, anxiety and depression. And they may also struggle with making and keeping friends, so this may also lead to them feeling socially isolated or misunderstood, which can then impact their self-esteem. Girls often develop strategies which help mask their symptoms, for example, by trying to be overly organised or be a perfectionist. And although less common, some girls do exhibit the hyperactive and impulsive behaviours, but these may manifest in more subtle ways, such as fidgeting, having difficulty sitting, being a chatterbox, or having an active inner dialogue or self-talk. Symptoms of ADHD can often intensify during puberty for girls, whereas for boys they tend to decrease. For girls, symptoms may not emerge until later in life, when the structure of home life changes or there are different rules and expectations and responsibilities. Although ADHD can present with challenges, there are many strengths and positive aspects to ADHD, which are often referred to as ADHD superpowers. So some of these are the ability to think outside the box, being creative, good at problem solving. This allows them to come up with some creative ideas and unique solutions. When something really interests them, they can become hyper-focused on the task for a long period of time. This can lead to really great outcomes. They also have lots of energy, so they can be very, very lively, enthusiastic, and their high energy can be channeled into activities that they're passionate about. Being empathetic and open-minded, they are often very accepting and non-judgmental of others. They're impulsive, and this impulsiveness can be used positively. So, for example, it can lead to more spontaneous and exciting experiences, swift decision-making, the ability to adapt quickly when faced with new situations or challenges. They're often funny, entertaining, dynamic and adventurous individuals, and these things also often make them engaging and good conversationalists. Their willingness to try things or take risks can lead to unique opportunities and personal growth, which in turn can help build resilience. So with the right support, encouragement and acceptance in place, individuals with ADHD can utilise their unique strengths and really flourish. The exact cause of attention deficit hyperactivity disorder, ADHD, is not fully understood, although a combination of factors is thought to be responsible. So firstly, genetics. ADHD tends to run in families, and in most cases it's thought that the genes you inherit from your parents are a significant factor in developing the condition. Research shows that parents and siblings of someone with ADHD are more likely to have ADHD themselves. However, the way that ADHD is inherited is likely to be complex and is not thought to be related to a single genetic fault. Brain function and structure. Research has identified that there's possible differences in the brains of people with ADHD from those without the condition, although the exact significance of these is not clear. For example, studies involving brain scans have suggested that certain areas of the brain may be smaller in people with ADHD, whereas other areas may be larger. Other studies have suggested that people with ADHD may have an imbalance in the level of neurotransmitters in the brain, or that these chemicals may not work properly. Other factors. Certain people are also believed to be more at risk of ADHD, including people who were born prematurely, so before the 37th week of pregnancy, or with a low birth weight. Also those with epilepsy. Diagnosing ADHD in children depends on a set of strict criteria, and to be diagnosed with ADHD, your child must have had 6 or more symptoms of inattentiveness or 6 or more symptoms of hyperactivity and impulsiveness. To be diagnosed with ADHD, your child must have also been displaying symptoms continually for at least 6 months, started to show symptoms before the age of 12, been showing symptoms in at least 2 different settings, so for example at home and at school, and this is to rule out the possibility that the behaviour is just a reaction to certain teachers or parental control, etc. And symptoms must make their life considerably more difficult on a social, academic or occupational level. And the symptoms are not just part of a developmental disorder or a difficult phase, and they are not better accounted for by another condition. So we're now going to take a look at some of the ways that you can help support children with ADHD. These are examples of some general support tips which are a really good starting point for supporting a child or young person with ADHD. So building routines into daily life can be really helpful. That's something that we're going to talk about a little bit more later on. You can encourage activity so that they can use up some of their extra energy in positive ways, and you can also support them by providing calm time, so giving them quiet space regularly to prevent them from becoming overwhelmed and or overtired. Supporting building the self-esteem is really important, so helping them to reduce their negative self-talk. You can also remind them what they are good at, give praise for trying or having a go, and remind them that we're all different and that everyone has different things that they find either easy or difficult. Spending one-to-one time with them, doing the things that they enjoy, is also a really good tip, and also allowing them some time, focus time for their preferred activities. Use of visual information, again, is helpful, and that's something that we're going to talk about a little bit more later. Allowing movement breaks, so having short, frequent breaks to allow them to move around, can help increase focus and concentration. It helps them to manage their high energy levels, which can also reduce restlessness and help to reduce stress and promote calmness. Help them to normalise their feelings through open discussions about feelings, letting them know that their emotions are valid. And it can also be helpful to have some ideas of healthy distractions that they can use, as young people with ADHD can become bored easily. Strong emotions can sometimes be at the root of behaviours that challenge that children with ADHD may display. Helping your child to express and manage their emotions appropriately is the best way to reduce problems and conflict in the long term. Many children with ADHD experience large outpourings of emotion, which some families call tantrums, outbursts or meltdowns. The best way to deal with strong emotions is to teach children how to recognise and express their emotions. You can talk to your child regularly about their feelings, notice their moods and help them to notice them. Talk about emotions with your child in an appropriate and child-friendly way, and it's important not to transfer any worries onto your child. Let them know that it's normal to sometimes be happy, frustrated or upset, etc. Using play can be a really good way of doing this, as discussing emotions of characters can also be part of the play. Help them to notice where they feel emotions in their body. Help them to express emotions using a picture chart, for example. You can encourage them to paint, draw or to write and express their feelings. You could also encourage them to listen to music or do activities that fit with their mood. You can help your child to learn how to manage their strong emotions by exploring with them the different ways that they might cope by asking questions like, when do you feel annoyed and upset? What happens when you feel annoyed? How do you eventually calm yourself? There are many great children's books that describe everyday social situations, such as going to a new school or meeting new friends, that you could read with your children to model good ways of dealing with social challenges and to use as a point of discussion. You can also provide a calm space that your child can use, which can contain all of their favourite items and sensory supports. This can help them to feel relaxed and safe when they are feeling overwhelmed. Helping children with ADHD to develop emotional regulation skills through soothing and grounding techniques can be very effective, but be aware though of boredom and make sure that you're refreshing these techniques regularly to help keep your child interested and engaged. You might use things like sensory comforts, so you could use sensory tools like stress balls, fidget spinners or weighted blankets to provide some comfort. And you could also practice mindfulness exercises or grounding techniques. So for example, the 5-4-3-2-1 technique, you'd have your child identify 5 things that they can see, 4 that they can touch, 3 that they can hear, 2 that they can smell, and 1 thing that they can taste. This is really nice because it helps to bring them back into the present moment, helps them to focus in on the surroundings, and it's also getting them to engage with their own senses. Another one that you could try is a room search grounding exercise. So this is where you would ask them to pick a particular colour, or you could ask them to pick a shape, and you would then ask them to try and name as many things within the room of that colour or that shape that they can see. You could also use their special interests by encouraging them to spend time doing this as a way to focus and calm, and you could even encourage them to incorporate this as part of their daily routine. The PACE approach, which was developed by clinical psychologist Dan Hughes, is also very helpful. This stands for playfulness, acceptance, curiosity and empathy, and it's an approach that we're going to discuss in more detail a little bit later. You could use a visual aid like an emotions wheel or emotions cards to help your child identify different emotions. Using breathing exercises is also really helpful as a way to help them to kind of calm and regulate. So doing some fun breathing techniques such as bubble breathing is a really helpful way to teach them how to use breathing effectively. So particularly for younger children, bubble breathing's simply using blowing bubbles to help introduce your child to calming breathing in a fun way. By focusing on trying to blow big bubbles, children are encouraged to focus on their out breath and breathing in slowly in a calm way. So this can really help them to understand how it feels to do calm breathing and to see if it can work as a calming tool for them. As with any new skill, you'll need to help your child to practice their breathing so that they eventually can remember to use it as a tool to help them calm down when they are feeling overwhelmed or anxious. A fun way of doing this is to keep a tally sheet with your child of how often they might use this. Also, think about language use and how you talk about negative behaviour. This can be really important. It can really impact your child's self-esteem. So we're going to look at that in a little bit more detail now. Okay, so how do we respond positively then to some of the behaviour that challenges which children with ADHD may display? So having positive ways to manage this behaviour is going to help your stress levels to be reduced as well as helping your child to cope better. So we're going to look at a technique now where it's 3 steps that we're going to use. Firstly is the press the pause button. Second step is tune into what is happening. And then step 3 is create a response and prevention plan. Okay, so step 1, press the pause button. When dealing with a challenging situation, it's easy to repeat the pattern of reacting to it in the same way each time, even if this is not working for you. So the first step to solving problems is to pause instead of reacting immediately. Pausing gives you time to understand what it is that's causing the behaviour, to think about how you want to respond, and to come up with an effective plan. Step 2, tuning in, is about trying to understand how your child is feeling and what is causing the current challenge. The key is to try and get inside your child's head so that you can understand what is going on. And it's also important to tune into your own feelings. When moments like these occur, ask yourself the following. What is my child feeling right now? What is going on for them? What am I feeling right now? What is going on for me? Focus on what you want to happen. Think of what you want to be different about the behaviour and what might be realistic to achieve. Sometimes you can have the goal of eliminating the concerning behaviour, and sometimes the goal is to reduce the frequency of the behaviour. At other times, the goal is to teach your child a new alternative behaviour that is less damaging. Come up with solutions. Think of all the possible ways that you can respond to the problem. When coming up with solutions, be as creative as possible and try to think of as many as possible. Remember to seek support and help from others, such as your child's teacher or any professionals that you may be working with, such as a psychologist, occupational therapist, or a speech and language therapist. Please note it's the parent who needs to think of the solutions at this time, not the child. With the child, it should be soothing rather than solutions. When a young person is dysregulated, they won't be able to find the solutions. So leave time after dysregulation and let them come to you when they are ready. Step 3 is create a plan. A response plan is about coming up with a set of strategies to help you manage when you experience challenging behaviour. The goal of your response plan is to think through how you can respond in a calm, thoughtful way and get through this difficult bout of behaviour. Think of every what if and have a plan to respond no matter how your child behaves. It can help to write your response plan as a series of steps so that you will know how you will first respond when the behaviour happens and what you will do next if it continues to happen. Note carefully how your child responds to each of your strategies. If it works, keep doing it. If it makes the behaviour worse, then try something else. Eventually, you'll have a tailored response plan. The single most important thing that you can do to support a child with ADHD to reduce their concerning behaviour is to prevent it. A prevention plan can help your child to learn to cope with daily challenges and prevent the problem behaviour from arising. A prevention plan might include changing routines to reduce or prevent the problem from happening, teaching your child a new positive behaviour to replace a negative one, changing your own expectations and how you respond, prioritising your own relaxation so that you can be less stressed and more relaxed, seeking support or help from extended family members, from outside of the family or from a local parent support group, linking in with school and other services for your child so that you can all work together to manage the behaviour. PACE is a useful approach for building relationships and trust. It's an approach that was developed by Dr. Danny Hughes, and it was primarily for working with children and young people who had experienced trauma, but it is also a really useful approach for all young people. So P stands for playfulness, and this is about making our interactions and tone playful, which can really help to build relationships and form connections. Playfulness can also be used as a good distraction when a child is feeling overwhelmed. A is for acceptance. So this is really important. It involves accepting the emotion without judgment, but not necessarily the behaviour. So for example, when a young person tells us that they're rubbish, they can't do it, we might, with good intentions, reply by saying something like, "Don't be daft, yes you can." But actually this can dismiss that emotion, which is very real for that child. So instead we could try saying something like, "I know you feel like you can't do it, but I actually think that you can do it because I remember a time when you did," give an example, "really well." So this acknowledges their emotion, but also gently encourages them to see it a different way. This is also a really good way of connecting with them and then redirecting the young person to a more helpful way of thinking. C is for curiosity, and this is about being curious in all of our conversations as to the cause of any behaviour, where it's coming from, why they're feeling that way, because all behaviour is a form of communication. And then E is for empathy, and this is about connecting with how they are feeling by showing our empathy. Having clear routines lets everybody know what's expected, helps to prevent problems, and creates helpful habits for everyone. Consistent daily routines can help you to reduce and manage many challenges associated with ADHD. So one of the keys to creating a happy home is establishing clear daily and weekly routines with your children. Children with ADHD can find it hard to remember multi-step tasks. They can easily become overwhelmed with too much information and find it difficult to get started. Having a clear routine and ordered steps can really help to get everything done and avoid stress. Consistent daily routines can help you to reduce and manage many challenges associated with ADHD. For example, establishing an early bedtime routine that starts at the same time each night can help your child sleep better and for longer. This will mean that they are more rested in the morning and more able to concentrate in school. Children with ADHD can have excess energy and find it hard to sit still in school, so integrating a relaxing walk or active breaks into the after-school routine can help them to relax. Completing homework can be a great challenge for many children and parents, so creating a step-by-step homework routine that shows how to get started, clearly explains what is expected, and is followed by something rewarding can make a real difference. For children with ADHD, routines can be crucial. With other children, you may have some days that are a bit chaotic and get away with not having a routine. But for children with ADHD, this can be a real problem. Usually, you have to go the extra mile to be super organised to manage the day. Here are some tips that can help. Break it into small steps. It takes time to establish a new routine, especially if your child is used to doing things a different way for a long time. This often means starting with small steps that can be slowly increased to make a significant change. Changing routines requires a gradual approach. Only try to change your routine when you have time and patience. Explain the routine in advance. Sit down with your child and go through the steps of the routine in advance. Involve them as much as possible and let them make some decisions. For example, they could choose which book to read or what game they enjoy. Use rewards to get started. In order to start a new routine or to make a change to an existing routine, consider using extra rewards to help motivate your child to get started. For young children, gaining stars or stickers to put on a chart can be enough to motivate them. For older children, a points chart can work best, where the child earns points for good behaviours such as household chores. The points can then be turned into rewards at the end of the day or week, such as a small treat or choosing dinner. Be encouraging. Being positive and encouraging is really important to make routines and rewards work. For example, if you're helping your child to learn to dress independently, be really encouraging as you go along. So, for example, when you see them trying, say, "You're really doing well, you've got your trousers on, only your jumper to go now, nearly there." Have a natural reward at the end. Routines can work especially well when there is something enjoyable to work towards at the end. For example, reading together when ready for bed, playtime after homework, TV after doing chores. Establish weekly routines. As well as establishing daily routines, take time to establish a plan for the week. Weekly routines ensure that everyone takes responsibility for chores and that important family events get done. Weekly routines can be created individually with your child as part of a planning ritual at the start of the week. You can also integrate them into planning with all your children as part of a weekly family meeting after a meal together. Use routines with all children. While your child with ADHD might particularly benefit from good routines, remember that routines will also benefit all of your children and you as a parent. Good routines can become a natural part of your family life. Another helpful strategy could be to use the Pomodoro technique. The Pomodoro technique was developed by Francesco Ciarello in the 1980s to help him study for university. It's a popular time management technique, but it can also be used to teach new skills, like a new coping strategy, by helping the child or young person to develop their attention span and focus. It works by setting a timer for a short time of less than 25 minutes. Initially, this could be shorter as you build your child's stamina. It also helps to use a visual timer for this. Your child would then start their task, for example, practicing the new coping strategy, and after the timer goes off, they'd take a 5-minute break before returning to the task to try again. This can be done 3 to 4 times before a longer break of 15 to 30 minutes is taken. It's important to do this when your child is calm and regulated, and it helps to make it fun and playful, so for example you could turn it into a game with rewards. You could also encourage your child to take a physical movement break between tasks if they have excess energy to release. The technique can be helpful to those with ADHD because it helps structure tasks into manageable bursts, which can help reduce feelings of anxiety and overwhelm, and it also can help prevent hyper-focusing on a task for too long. Some children and young people with ADHD might be able to focus intensely on certain topics or things though, and the Pomodoro technique might not be useful at this time, as it's important not to pull them out of this focus too quickly. Visual reminders and timetables can help your child to keep things more manageable and predictable. You can use visual schedules to make routines clear by showing what is expected and in what order. These might take the form of photos or drawings of your child going through the steps of a routine, calendars and diaries to help plan ahead. You could use phones or tablet apps, written checklists and reminders in key areas of the house, have visual timers and countdowns to help transition between activities. As they get older, your child may wish to use strategies that fit more in line with their peer group, for example using reminders on their phone, keeping lists in a notebook, or using their own whiteboard to sketch out plans. Make sure that schedules can be easily accessed by placing them where the task takes place or making it portable if tasks stretch across the day. You could also set up visual supports, and these could help to show the steps to completing everyday tasks, for example getting ready for school, preparing lunch, to list activities for the day or week ahead, which you could use in a diary or on a timetable. And you could also use visuals to help your child make choices, such as scooter or trampoline as the activity after dinner. It can also be helpful for helping them think through a new event, such as meeting a new school member of staff. And it can be used to generate lists of ideas, such as weekend activities or special treats. You can also use this to help them check that everything important has been completed before moving on to another task. And you can also create a reward chart which can help motivate your child to change a routine or to learn something new. So what can you do if more support is needed? The Open Minds website is always a really good starting point, and then like we discussed at the start, the Open Minds partnership includes lots of different services which offer different kinds of support and guidance around emotional well-being. If you're considering making a neurodevelopmental referral for your child or young person, just wanted to go over a few frequently asked questions. Firstly, what information is useful to provide in a referral? You want to ensure that you're detailing any risk and any emotional well-being concerns that you have as well. Also ensure that you make it clear what the referral is for. Is it for autism, ADHD, or both? Secondly, what happens once a neurodevelopmental referral to Open Minds CAMHS has been made? Once a referral has been received, neurodevelopmental questionnaires will be sent out to school as well as to the parents and carers, and this is when you need to detail all concerns. If the neurodevelopmental questionnaires are not returned within 4 weeks, then the referral will be closed. However, there is some flexibility that can be applied to this depending on the situation. I'm just going to give you a brief overview of the right to choose in Calderdale. You can make a referral for an autism assessment, an ADHD assessment, or both through the first point of contact at Open Minds CAMHS or through your GP. If the referral is then deemed suitable for assessment, you'll be offered the right to choose who provides you that assessment. So families can choose from a list of approved providers, or you can pick your own for approval to be sought. This is an example of what the referral pathway looks like for young people over the age of 5 making a referral through the first point of contact. You might want to pause the video here and have a look at some frequently asked questions about the right to choose if this is appropriate for you. And here we have some further contact details if you still have some questions about the right to choose. We also have a digital mental health offer called Silver Cloud. There are currently 7 programs available for children and young people and parent and carers. It's free, there are minimal wait times, and it's really good for early intervention. However, it's not suitable for any children and young people where there are any risk concerns. And although it's digital, you do get a supporter who will give you weekly advice and encouragement. So I'd like to finish by saying thank you very much for listening. I hope you found this workshop informative and useful. There's lots that we could have covered here, but I'm hoping that it's given you a good introduction in understanding ADHD, as well as some helpful strategies for supporting your young person. Thank you very much for your time.